This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy.
We are rolling on the Berman Method podcast, treating problems and not symptoms. David going against Goliath, where the corporate medical system does not have your best interests in mind. Big pharma, the health insurance companies, they are going to choose profits over patient outcomes every time because a patient cured is a customer lost. It is that simple. Dr. Jake Berman here with my beautiful co-host,
Jenni Berman, physician assistant.
And Walker Ryan Bermanator.
He's just hanging out here. Definitely more alert. Hanging out in my lap.
Way more alert. Got his little paw onesie on. Paws all over him. So cute. Oh my goodness, you're just so cute.
And he's going to be 5 months. Well, he is 5 months by the time this is being released.
Look at that smile. Oh my goodness. Smiling with his whole head. His whole face, I mean.
His whole face does smile. People comment on that all the time. If you're wondering, he still has blue eyes.
They are still blue.
Very blue.
Really blue.
Yeah.
Holy cow.
So recessive gene going strong right now.
If it wasn't for those ears, I would think he was the mailman's. Those are definitely my ears, though.
He has your ears and your nose. Yes.
He wasn't 3 minutes old, and the first thing you said is, oh my gosh, he's got your ears.
I did say that. Since I was actually coherent during this delivery, I got to see them when they were born. You see him when he was born, and yes, I said he has your ears before I even held him.
Yeah.
But that's okay. They're cute.
Of course they're cute. They're mine. What do you think about that?
You're cute. You turned out all right.
I turned out all right.
Yeah. All right.
Yes, here we go. David against Goliath. It is getting more and more clear that the health insurance company's number one job is to deny. I mean, we talked about it last episode and probably a few of the past episodes. The amount or the frequency of which we're getting irate customers, not us personally. The health insurance companies are getting more irate customers. It's increasing the frequency because there's so many more people that are being smarter about their health care, and they're choosing to go to out-of-network providers and pay in cash to get the health care that they want instead of what they have to get for somebody that is in-network. So going to an in-network provider that may not be qualified or the expert that they're looking for, and then trying to submit for out-of-network reimbursement on their own. And 100% of the time,
it's a headache.
It's a headache.
Yeah.
100% of the time, it's a denial.
Mm-hmm.
You put the period in the wrong place. There's a smudge on your signature here. It's just, they find the craziest things to deny. And I cannot tell you. So I've been doing this for 10 years, right? I haven't taken insurance for 10 years. And of course, there's the people that want to submit for out-of-network reimbursement. So I'll give you a super bill to submit for out-of-network reimbursement. And historically, it's been just a couple of headaches. Over the past 6 months, it has been 100% headache, just a tenfold increase on what they're denying. And it's erroneous.
Yeah.
It's not even true.
I had a patient get denied because I gave too many diagnosis codes.
Like what?
Too many.
What?
Yeah. And I was like, they were like, they want one. And I'm like, well, one's not going to get very much covered. Like I put multiple because this is what you're experiencing and this is what we're treating you for. So this is what they should cover. But then if there's too many, then there's too many reasons that they should cover it.
Yes. And at the end of the day, you got to look at health insurance just like you look at your car insurance. You would never, ever ask your car insurance to reimburse you for an oil change.
Right.
You're not going to ask your car insurance to reimburse you for new tires, new brakes, or tire rotation, or a maintenance on your AC. You're not going to ask your car insurance to pay for your detail. So get your car detailed. I want to wax my car. Do you think that State Farm will reimburse or Progressive will reimburse for detailing my car?
Right. We don't ask for reimbursement for massages.
Yeah.
So why is your treatment of your gut or your shoulder any different? Yeah.
It's just a paradigm change because historically that's it's the way it was. I mean, this is so outdated though. I mean, it really started changing back in the 90s. Here we are almost 30 years later and people are still trying to grasp on to the old way of doing or having healthcare services. And it's changing. Hopefully we're preaching to the choir here. Hopefully if you're listening to us regularly, you get it by now and you're making the right decisions.
And if you're not getting answers, you need to find most of the time an out-of-network provider to help you find the answers. And I'm living this right now with a client who unfortunately has been not well for 5 years and has been seeing tons of different providers over the last 5 years, including a rheumatologist, a neurologist, and my first set of blood tests I did on him, I started finding answers right away and had to do more testing. I had to do more blood testing and called him right away and said, I think we need to further investigate this. But it was a blood test that I did that no one's done on him in 5 years. Like, why did it take 5 years for that blood test to get done to start finding some answers?
Speaking of finding answers, so I think we've mentioned a few times over the past couple of years on this podcast, our dentist that we go to, Park Dentistry. It's right across the street from our office. And about 4 years ago, it was right around COVID, I wasn't happy with the dentist that I was going to. I wasn't unhappy. I just wasn't happy with it. So I'm going, you know what? Why don't I shift my mindset and find somebody that might provide a better service, a better product, and pay money out of my pocket? Because me too, I was guilty of this. I was only going to a dentist that accepted the dental plan that we had. And I was like, I got to do it. I've got to practice what I preach. So the first thing I had to do is I go on Google and I Google dentists. And there's 2 dentists in the downtown area that are so far ahead of the competition on Google reviews that it's not even close. I mean, it's 1,000 or 2,000, something crazy, like 1,000 to 2,000 5-star reviews. And there's 2 of them. And then the other 75 dentists in the area have 5 reviews or 10 reviews, less than 50 reviews. And I'm going, holy cow, what are these places doing differently? One of those places was right across the street from me, Park Dentistry. So I went to them. And the experience that I had walking in the door was just insane. I didn't even tell them that I had insurance because I just wanted to pay out of pocket. I wanted to see what the service was. And I've been going there ever since. Jenni and I have been going there ever since and paying $150 to $300 every single time we go. I go at least 3 times a year, if not 4 times a year.
I go 4 times a year. Yep.
And it wasn't until last week when I went there again and I overheard one of the other admins saying that we're out of network with everybody, all insurances. And I said, how long have you been out of network with all insurances? And the lady I was talking to, she goes, probably 3 or 4 years now. And I'm going, this is insane. Absolutely insane. I had no idea that they didn't take any insurance at all.
I didn't either.
But the product, the service, the employees, everybody is so happy when you walk in there. They call me by my name when I walk through the front door. The place is clean. It smells good. The actual product itself is great. I mean, everybody is just happy. And this place is big. It's not small.
Mm-hmm.
And people are willing and able to pay out-of-network prices to go to this place because it's a better product.
Right, right. And they're not pushy at all, which is the other nice thing. And you would expect as an out-of-network clinic and everybody's paying cash that they would be pushing you to do all these crazy things and procedures and, composites and things like that. And they're not even pushy. They're like, this is what we see. You make the choice. It's really nice.
Love it. I absolutely love it. So you got to get smarter. You got to spend your money on where you think you're going to get the best product, and you got to do your research. It's that simple.
So do we want to talk about what we were planning to talk about?
Yeah. One of our good buddies requested that we talk about low T because it's a popular topic in the news, not the news, sorry, on commercials. You see it everywhere, where these med spa clinics are popping up left and right all around town and virtually for low testosterone, especially for males.
And it's not surprising. It's not surprising. Definitely, in my opinion, more and more young males are having lower and lower testosterone levels in the recent past. So just in the last 15 years, men in their 30s and low 40s are getting low levels of testosterone, which isn't how it used to be. We didn't have this testosterone problem 20 and 30 years ago. Maybe we did and we just weren't testing it, but I don't think so. It was not as prevalent of an issue because our food was cleaner.
Is that the reason why?
That's a very big part of it. Just the pollution between our food and our environment is so much greater now that it definitely is impacting testosterone levels and all hormone levels across the board for males and females. There's a lot that goes into it, right? It's way more than just the pollution of the environment and of our food, but it's the implications of that along with high stress levels, the amount of stress that people are under now versus what they were under 30 years ago, the amount of sugar that we're consuming. So what our blood sugar stability is like is playing a huge role as well. So there's a couple of primary reasons that hormone levels will shift and that males specifically will find lower levels of testosterone, females lower levels of progesterone, both males and females higher levels of estrogen. And when I have an individual coming in with concerns of hormone imbalances, telling me, I think I just need to go on hormone replacement. I've tried everything that I can possibly think of. I'm sleeping terrible. My energy is really low. I don't have the recovery in the gym that I used to. My muscle mass is declining. My fat percentage is increasing. Not sleeping through the night. For females, they're having night sweats at night. Their mood is shifting, low libido. These are all the symptoms that people are coming in with saying, I'm throwing in the towel. I just need to go on hormone replacement. And a lot of times I say, okay, well, actually every time I say, well, that might be true, but it also might not be true. Let's look a little bit deeper, specifically at blood testing that nobody's looked at yet. Yeah, your doctors are saying, okay, these are your symptoms. Here's the pill, or here's the cream, or here's the patch, but we're not actually looking at the cause. Why are hormones decreasing when you're in your 30s, your 40s, your early 60s?
What would be a couple of typical symptoms of a 30 to 40-year-old male with low T?
Well, I just said a whole bunch of them. So not sleeping through the night, not being able to gain lean muscle mass or finding that they're losing muscle mass, gaining fat mass. So they haven't changed their diet, they haven't changed their exercise, and they're just gaining fat mass as opposed to being able to see the recovery in the gym. Fatigue is a big one. Just feeling, not that you need to go take a nap, but just feeling lethargic throughout the day, not having that burst of energy that you're typically used to doing, not being able to do everything on your to-do list without just feeling exhausted. Having brain fog. Brain fog's another one that a lot of men will complain about, where they just say, I'm just not thinking as clearly. feeling more irritable. So they're quick to snap and just irritable to people that they're not usually irritable around. Sometimes headaches, waking up with a headache can be a sign first thing in the morning. Not feeling hungry in the morning. So if you have a low appetite in the morning and you're just not able to get in the amount of protein that you think is necessary to gain muscle mass is another symptom. And then libido, of course, is another one.
Okay. So the first thing that we would do is what? If I say that I've got 1 or 2 or 5 or all of those symptoms, what's the first thing that I would do?
First and foremost, we have to check blood sugar control, blood sugar stability, and cortisol levels. Those are 2 primary things that are going to go into hormone imbalances, specifically where our body is not excreting or balancing estrogen levels well. So in men, testosterone levels are driving down, progesterone levels in females are driving down. We have to look at blood sugar control and cortisol levels. These are done via blood testing and saliva testing. So we can actually see a 24-hour cortisol curve. What does your cortisol curve look like throughout the day? It naturally should rise first thing in the morning and then come down to its lowest point around midnight. So we need to look at the whole 24-hour curve, and then also looking at different testing for blood sugar stability. And that does not just mean looking at your fasting blood sugar in the morning.
Okay. Is that where the CGM, the continuous glucose monitor comes in?
The CGM is a great tool, a fantastic tool to be able to look at your blood sugar 24 hours a day over a 2-week, 14, 15-day period, so we can actually see how often is the blood sugar rising and falling. How often are you staying above 100 for your blood sugar, whereas we should be naturally below 100 throughout the day besides the times that we're eating. So the CGM, the continuous glucose monitor, is a little sensor that goes underneath the skin and shows us what our blood sugar is doing 24 hours a day. Super, super beneficial. We can see what is causing your blood sugar levels to elevate. Is it that you're not eating enough? You're not getting enough protein. You're getting too many simple carbs. You're eating foods that your body is sensitive to. Food sensitivities and allergies can make glucose levels spike. Is it stress? Stress will cause your glucose levels to rise. So definitely the CGM is helpful. There are other baseline blood testing that we'll do in our office, including an A1C, an insulin, a triglyceride level. So there's different blood tests besides just your fasting blood sugar that gives us a lot of information about blood sugar control and hormone balance.
Oh, wow. It sounds like a lot.
It's a stepwise process, but you can't do it on your own. And unfortunately, a lot of primary care doctors don't do it. When you go in and tell them as a 42-year-old male that you're just feeling fatigued all the time and you're gaining fat and you're burning muscle and you're not sleeping through the night, then they're going to say, okay, great, go to the urologist or go to this, stop-in clinic and pick up your testosterone injections and good luck. The problem with it is we're not treating the problem. We're not treating the problem of you having what we call insulin resistance, which is actually what's driving testosterone down. We're not fixing the problem of you eventually becoming a pre-diabetic. And there's side effects to taking testosterone that a lot of clinics won't tell you. You, first and foremost, must get prostate exams to make sure that we're not increasing the risk of prostate cancer, as that is a side effect of testosterone replacement. But it can also thicken the blood. So it can cause iron levels and hemoglobin and hematocrit levels to go up, which can increase the risk of a heart attack or stroke. So if you already have a family history of cardiac disease, that would not be ideal. Can drive other hormone levels down. It can affect your melatonin production. It can affect your magnesium. So there's definitely side effects to utilizing testosterone where we could focus on fixing the problem of blood sugar control and cortisol control.
Okay. So step number 1 is
get evaluated appropriately with blood testing and cortisol testing.
Okay. So getting blood work, the appropriate blood work to check cortisol level and blood sugar level.
Blood sugar stability, not just the blood sugar level.
Okay. Is that step one, or is step one to do a test to see if testosterone is actually low or not?
Well, I think we would do that simultaneous. If you're going to have blood testing to check your testosterone levels, simultaneously, we would look for the cause of low testosterone levels.
Okay, so we can do it simultaneously.
Yeah.
Good. So one needle prick, and we got step number one done.
And then step 2 would be making the appropriate dietary changes to control blood sugar and cortisol level, using the right amino acids and vitamin levels to control blood sugar and cortisol levels. And then if it's necessary to have the hormone replacement, to doing something like a precursor to testosterone, tribulus, or using actual hormone replacement therapy, if that's necessary, then we go that route. But we first want to find the problem. Let's fix the problem. Let's focus on the intake, the amount of protein that our body needs, the amount of fiber that our body needs for blood sugar and cortisol control. Most men are not getting enough protein. And getting 12 ounces of protein at one sitting is not getting adequate protein for your body. Eating 1 or 2 meals a day with 10 to 12 ounces of protein at your meals is actually negatively affecting your body. So please don't do that. Focus on adequate protein. For females, 4 to 5 ounces for your meals, breakfast, lunch, and dinner, plus another 2 to 3 ounces between your meals. So for your morning snack and your afternoon snack. For men, we're looking at 5 to 6 ounces of protein at breakfast, lunch, and dinner, plus another 3 ounces at your snack in between meals. So 5 times a day we're eating lean protein.
Okay, good.
That's the starting point.
I like that. I really like that. We've got some clear objectives. So step number one is to get your blood test to see what the levels actually are. Step number 2 is to make the necessary changes. And for the vast majority of men and women, it's as simple, not easy, as simple as increasing quality protein uptake throughout the day.
For sure. Quality protein. And we could podcast on this again. Maybe we'll have part 2 next week, because there's there's other things that will go into it besides the protein intake when it comes to helping the body to regulate blood sugar, cortisol, and testosterone production. So there's, like I said, different vitamins, different amino acids, strength training regimens that need to be discussed. So there's more that goes into it. But rather than going to the one-stop shop of just getting the testosterone injections, let's fix a problem and not just treat the symptoms.
Love it. Absolutely love it. Let's end on that note, and make sure you like and subscribe. Share this episode with somebody that you think needs to listen to this and hear how simple, not easy, how simple it could be to make some significant changes.
Ciao for now. Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.